All right, ladies and gentlemen, good evening. We are so happy to see all of you, and we are live with a stellar crew here tonight. Let me just start introducing folks to you. Kathy Turner is the lovely lady waving at you with the fabulous glasses and the sunflowers in the background. Misty Ellis has the gorgeous UK blue background, and Delanor Manson with Kentucky Nurses Association background, and Dr. Mark Burns. I'm going to let them each introduce themselves and just give you a little taste of the level of expertise that we're dealing with right now, because these three are in so much demand. I really appreciate them taking this late call tonight, because a lot of people are sitting around at home in the cold looking for something important to do and looking for something valuable to learn. So that's what we're doing right now. We just want to educate, inform, and give everybody a chance to ask questions, which you are welcome to post in the streams. Try to post a lot of your questions on the 502 live streamers page so we can keep track of them. We would very much appreciate that. And Kathy from the health department, Kathy Turner, you just do an amazing job every single day, getting people tested, getting people vaccinated, getting the word out. Just talk to us a little bit about the challenge that the health department has had for the last going on 3 years now.
Oh my goodness. Thank you, Tara, first of all, for inviting me here with this wonderful panel of experts. I think the other day I was looking and we are on something like day 680 of our pandemic response.
Wow.
I know, and Delanor is like, because Delanor is, and the Kentucky Nurses Association has been in there with us pretty much since the beginning. It's just a challenge, with the health department. We want to do everything we can to try to protect people from unnecessary illness and suffering and death from this new and novel virus. And we just, we have worked really hard to try to communicate the facts, to provide testing all over our city and vaccines, and make sure that people who have the right instructions for if they have to quarantine or if they need safe places to quarantine and isolate, how we can help them. It's just our COVID response has been huge and daunting, but that's what public health does. And we might be tired, but we are honored that we get to do it.
Yep, absolutely committed. If you would, Delanor, introduce yourself and just tell us about your role in this whole process, because you truly are a frontliner.
Well, I'm Delanor Manson. I'm the CEO for the Kentucky Nurses Association, representing 88,000.
You got real muted all of a sudden, Delanor. Try to speak a little bit louder or move your mic up.
Okay, how's that? Better?
That's much better.
Okay. I'm Delanor Manson. I'm the CEO for the Kentucky Nurses Association. We represent and support 88,000 nurses around Kentucky. We got started early in the pandemic with doing some testing, drive-through testing. I think we were the first people who were doing the drive-through testing, and then to help support with LUVAX and help to staff that. Since that time, we've been doing testing and vaccinations all over the city. We have a small team of people who show up every day to make sure that that happens. But that doesn't happen without the health department's support and yours, Kathy. And let me just say thank you. And Tara, I want to say thank you to you for taking the time and making this happen so that there is a place for people to go to get questions answered and for them to hear some of the difficult things that they need to hear about COVID, vaccinations, testing, and what they can do to keep themselves safe.
Well, this is a 502 live streamers collective effort. I am just the person who made the connection and the Zoom meeting. So thanks to all of the 502 live streamers. Antonio Teammate Taylor just joined us. Riot Heart is there with the red hat on and his gorgeous shirt that says Riot Heart. So the three of us are live streaming to a number of platforms. It's on all of our pages, and we hope that people will tune in to listen and ask questions. Dr. Burns, if you will, please introduce yourself.
Certainly. I'm Dr. Mark Burns. I'm an assistant professor at the University of Louisville, the Division of Medicine, in the Infectious Disease Department. I've been on the front lines of the pandemic since the very beginning. I not only do teaching and instruction, I also take care of patients as well. I see COVID patients every day. I have been for the past almost 2 years now. And it seemed the evolution of this disease from its beginning, when we knew little of anything, to a point where we have much more knowledge than we've ever had before. And not only that, but we also have better treatments now than we did in the very beginning. So I've pretty much seen the whole spectrum to this point. Unfortunately, there's more chapters to be written. I wish this book was done, but unfortunately, it doesn't look like it's going to be anytime in the immediate future. So I'm still dealing with it, and everything I learned and everything I am exposed to, I try to make known, given a medical expertise, using good judgment and with patient care to impart to everyone that can hear my voice.
Absolutely. And Misty, our UK professor of nursing as well as a nurse practitioner, please introduce yourself.
Hi, everyone. Thank you for having me. This is a tremendous opportunity to be here with this panel. So as Tara said, my name is Misty Ellis. I am an assistant professor for UK College of Nursing for the Pediatric Acute Care Program. I'm a proud member and board member for Kentucky Nurses Association. So I'm very connected with Ms. Delanor. But also my clinical role in practice is a pediatric acute care nurse practitioner for Kentucky Children's Hospital in the Pediatric Intensive Care Unit. So pediatric intensive care units are areas in the hospital that take care of the sickest of the sick of children. So anybody critically ill, any child, adolescent that is critically ill goes to the pediatric intensive care unit. And unfortunately, over the last year or so, we are seeing our fair share of COVID patients. And so I am now taking care of children. It's very interesting to me, the evolution of all of this, because initially when, this sort of, hit our streets, our culture, our environment, we didn't see this in children. As vastly different now. We are taking care of some really sick infants, children, and adolescents with COVID. And so I see those patients in the intensive care unit in my practice. And so I'm here to share my experiences and be a part of this panel and talk about that tonight.
Well, I'm so glad you're here. I just found out that my great niece, who's 3, and my great nephew, who's 5, in Mississippi, both have COVID. So I'm very concerned about them, and their daddy is taking very, very good care of them. But thankfully, the adults were vaccinated in the house and boosted. So hopefully they will be well. But man, I say, the neighbors across the street, one kid got it, the other kid didn't. It's just such a strange disease, and it does so many strange things. So as we're talking, I'm going to go to speaker view for each one of you when you're answering a question. So, you'll see just yourself probably on the screen. And I think that's probably the best way to focus the attention on you, because sometimes when you've got a panel up, people just get distracted. So we don't want to have that happen. So what we'll do is we'll just continue to ask questions, have you answer them. I'll go to the speaker view, and then we'll come back to the panel in between, if that's okay with all of you. So the first question that we have for Delanor, and I'm going to ask you this because it came in specifically for you, because somebody is very impressed with the work that you do. And they said, ask Delanor Manson to talk about the stress of nursing through this pandemic. From your perspective, from that of, and Missy, Dr. Burns, feel free to chime in, but specifically to you, Delanor, talk about the stress of nursing right now and why people are having a hard time understanding they need to get vaccinated to keep the hospital system from being overwhelmed. This is a thing that I guess there's a disconnect there. Talk about that.
I think it's a great question, because when we first started with this, you would hear about the nurses being the heroes and the sheroes, because they were showing up every day. They were taking care of a lot of patients that were very sick and they were dying. And so what has happened over this period of time is that so many patients have died, and patients have been so sick that nurses have become fragile, very, very fragile. Not to mention that as nurses are asking people when they're coming into the hospital to put on masks, they are being treated with incredible disrespect. And we are hearing about nurses that when they wear their scrubs to the grocery store, that people are spitting on them.
Oh, God.
That is not okay. These nurses are tired. They are physically tired. They are emotionally tired. They are psychologically tired, but they keep going to work because that's what the patients need. The other thing is that as nurses have continued to work, and that we have 80% of the patients who are unvaccinated who are in the hospitals. And I also want to address long-term care when we get to that opportunity. But they have more patients to care for than there are nurses to take care of them. We are in the middle of a nursing shortage. And that nursing shortage was here before the pandemic. Now it has been exacerbated by the pandemic in that there are more patients to take care of them, but no more nurses to take care of the patients. And we will have a nursing shortage after the pandemic if we don't address the nursing shortage today. So don't get me started on the nursing shortage issue in addition to the pandemic.
Yeah.
So nurses are tired, but they keep showing up. And we need to appreciate them for doing that. And Misty, you're one of those. And I want to say how much I appreciate you continuing to show up.
And Misty, feel free if you would like to chime in.
I think I just echo, Delanor's comments. It's really, people don't probably really appreciate the work and that it takes to take care of these patients. They're so sick and you're in isolation for hours at a time. And a lot of the work when people aren't in isolation, you have multiple people to help you when you're a nurse. But because you want to limit exposure, you as the nurse are primarily doing a lot of the cares for the patient by yourself in this room. And people are outside your room, maybe helping from an outside perspective, but it's the inside of that patient's room that it becomes so daunting. And the other thing is that some of these patients that are admitted to the hospital are admitted into intensive care units, whether you're a child or an adult. And that requires a lot more sophisticated equipment to maintain a patient's stability. And so there's a lot more things that nurse has to concentrate on. It's just been extremely exhausting. And it is true. Like I just was at a conference just last week, and so many people were leaving the bedside and going away from it because they were just tired and just exhausted from the demand.
That's the part that scares me the most, is the fact that so many people are so afraid and exhausted and unable to keep up. And that's one of the major problems that I think we're seeing in every employment area, in every industry, is a lack of workers. And if we don't have healthcare workers, we're in deep trouble.
Well, Tara, I'd just like to add a couple of things. We did a survey in October of nurses, and 25% of the nurses that were surveyed said that they were going to be leaving their jobs in the next 3 months. And also 16% of those nurses said that they were going to be leaving nursing in the next 3 months.
Wow.
Now, with 88,000 nurses in the state, you do the math.
Wow.
That's a lot of nurses that are not in the healthcare system. We had nurses from long-term care, school nurses, ICU, acute care, all over the spectrum participating in this survey. And it basically says we are going to be in trouble as the healthcare system. We also know that nurses are approximately 47% of the healthcare team. Everybody else is the rest. Now, imagine that 47% of the healthcare team, that 25% of those are no longer there.
Terrifying. Terrifying. Dr. Burns, as a physician, I know that you have had to rely on the expertise of nurses in everything that you do in your practice, as well as the expert advice that you get from particularly these two, in everything that you're doing. Talk to me a little bit about your perspective from the doctor's side of things.
Well, everybody knows the hardest working person in the hospital are the hardest working people in the hospital are the nurses. There's no question, no doubt about it. They're multifaceted, okay? because they fulfill physicians' orders that are done, but they also advocate for patients as well too. They're that middle person. They're that person that has to. It's sort of like a mother, if you will. They have to take care of the adults, the kids, everybody. Nurses, and they are so underappreciated. So underappreciated. They are the hardest working people in the hospital, and with the mistreatment that I've heard and seen as well too, it's no wonder a lot of them want to leave. I just think that they're just so underappreciated for what they do. There's so many things they do instrumentally behind the scenes that people aren't even aware of, and probably the best example is when you think about the COVID patients who are in isolation. Okay, honestly, and unfortunately, some of those succumb to their illness, and it's those nurses that are there that try to bridge that gap between the people's family members and the actual patient themselves.
Yes.
And it's just, again, we could spend a whole hour talking about how great nurses are, and that still wouldn't be enough time.
And I'm sure that Delanor and Misty would not object to that in any way whatsoever. So one of the biggest questions that has come up in my experience in the entire process of this incredible pandemic, something that I never would have expected to have lived through, and having heard stories from my grandparents about the last one, is just I think the complete lack of responsibility that people feel for their fellow humans. And I just see it evidenced over and over again. So it makes me wonder what it is that we can do to encourage people, and any of you go ahead and take this question, to not only realize that it's about getting a shot yourself, but about protecting other people, and explain why that's important.
Well, I'll be happy to start out.
Great.
I can tell you, I've always said, actually, Delanor's heard me say this too. If people thought more about others than they do themselves, there are so many of these problems we wouldn't even have. Okay, I mean, you hear people talk about, well, I'm healthy, I'm not going to get sick from the coronavirus, all these types of claims. And that may be fine and good, but they don't think about the people who may not be as healthy as they are, who they come in contact with. And they also don't think about children. Right now, our population, children 4 and below, they can't be vaccinated. So how can we best protect them? See, and a lot of people just don't think about what they do inadvertently to other people when they don't get vaccinated. And again, that's not even to mention the people who may be immunosuppressed, who don't even have a good immune system to fight this thing off like they do. So if people, especially the anti-vaxxer people, if they would think about other people, think about help protecting them, okay, maybe not so much for themselves, they should get vaccinated without any hesitation at all. But instead, they're thinking it's me, my body, my choice, that kind of thing, and not thinking about how it affects other people or the right other people have not to be sick.
Yes.
Tara, I served in the military for 27 years, and I'm a patriot.
Thank you for your service.
It was my pleasure to serve my country. But my point is, I served my country to protect my country. It wasn't about me. As a matter of fact, when you're in the military, you don't get any me. You get your country and you get your teammates. That's what you get. You don't get any me.
Yeah.
So the idea that and only 1% of Americans serve in the military. 1%.
Wow.
So you've got this 1% that's holding up the rest of the United States. And so to mark Dr. Burns's comments, if we could somehow infuse all Americans with the idea that they are their brother's keeper.
Absolutely.
And that they are responsible for their brothers. I think that a lot of the things that have exacerbated the pandemic, such as individuals not wanting to wear a mask because they feel uncomfortable. And so I say, gosh, at least you have a mask to wear. Or they don't want to social distance because they're huggy kind of people. Well, isn't it wonderful that you have someone that you can hug? Yeah. So I want to, back all that up to say, this has been a hard pandemic for a lot of people, but for the privileged, it has been a lot easier than for those who have nothing to work with.
Misty, did you have anything you wanted to add to that?
Well, I think it's fascinating from the pediatric perspective, because if you ask pediatricians across the state how many conversations pre-pandemic they have with parents about vaccination, like that's just part of an everyday child exam and your, the needs that your child needs. And, there are a very small percentage of parents across the state that have not, taken advantage of any vaccine. But, the vast majority of parents across the state vaccinate their children, right? They give them measles, mumps, rubella, so the MMR vaccine, right? They give them a DTaP. We protect children from that situation. And I think some of that comes with such a big push of education behind that. And I think we as healthcare providers just need to be sensitive of the information and be able to provide it to people, to provide some comfort and know that the science behind it is solid and that this is the way to eradicate this, and that how important it is, and keep sending that message, because that's what pediatricians and pediatric providers across the state, family practice reps, whoever is administering immunizations across the state and across the country do every day in practice with other vaccines. And it's the same principle. But it's also to Delanor and Dr. Burns' part. I mean, we have to kind of get back to that concept that, we're on a team sport, right? I always like to think of it as football. I'm in the middle of football season right now, and I love it, right? Yes, there's a quarterback, but that quarterback's not successful if he doesn't have a strong offensive line, right? So it's a team sport. And we living and thriving every day, we should be more team-oriented versus, self-oriented in this aspect.
So while we've got you, somebody just mentioned, I do believe the public has been shielded from some of the most heartbreaking stories. For example, a first grader who catches COVID, ends up in the hospital, has a stroke as a result. The family is left with a gut-wrenching decision whether to maintain life support or not. Just talk for a moment about those parents who are hesitant to vaccinate their children, and what it is that you can say to them to give them some reassurance that it's okay to go ahead and take that step. Because I was there for a live stream of the first kids' vaccinations. Kathy invited us to that, and it was amazing. And, kids don't like to get shots, and there was a lot of screaming and hollering, but it was a very successful vaccination clinic.
Yeah, I think that, yes, I think some of it is, some people are hesitant. They don't want their children to have pain, but, it's a very short response. It's not really any different than, scraping your leg or something from that nature. The pain goes away. I never tell anyone that things are going to be painless. You don't lie to children. You be very upfront and very, straightforward. You don't lie to them. That does not gain their trust. I think that, parents need to know that the science is strong behind the vaccine, that this is going to prevent their child from becoming critically ill and being in an environment with me taking care of them. Yes, maybe your child will get it, but that vaccine may be the only thing that prevents them from being critically ill, placed on a ventilator, and even other mechanical support that we have seen in other children. And then sadly, we have seen children die from this virus. And and all of that can be prevented. It's why we don't see, measles the way we do. We don't see tetanus. There's reasons we give children vaccines because we don't want polio, right? We don't see that because we don't want them to have that. And the same thing applies for this. And I just think, honestly, it's gotten, some of the vaccines get a bad rap because the media aspect of it. There's wrong messages being sent, not people with good evidence or understanding or knowledge that might be spreading wrong information. And I think that's sad. I know it's happened. I know that's the world we live
Tucker
in.
Carlson. Tucker Carlson.
But I think that, that's where we are, sadly. But I just think that, go to true sources. When I think about resources, American Academy of Pediatrics is a strong advocate for all children. They're not going to, advocate on behalf of a child if they don't believe in it, if it's not scientific, and they are 100% backing this. And I think that, all other pediatric organizations are the same way.
Well, Tara Moneypenny, who says her name Tara instead of Tara, says, all in pediatrics, my son's pediatrician, Dr. Justin McGonigal, explained everything and answered all my 100 questions about the vaccinations. So good for you. Good for you.
Yeah, and I think that's important. Like if we just give people the information, and I think us as providers, we just have to be patient.
Yep.
And we have to be willing to give the information. And it's okay for you. We first should start by saying it's okay that you're scared, or it's okay that you're confused.
Yep.
I'm here to help you and alleviate that. That's okay.
All right, Dr. Burns, go ahead. Go ahead. Sorry about that, Delanor. Go ahead.
I just wanted to say, I wanted to give a shout out to the Louisville Public Health Department because they did a lot of listening sessions to find out how the community wanted to hear the information. They asked them what would make it important to you to be able to follow. And so with the listening sessions, they were able to come up with messaging in the form of printed messaging, as well as sending Dr. Burns out on the road trips to do talking to community members and to youngsters and answering their questions, because they have lots of questions and they bring the questions that their parents have because they hear their parents saying these things. And so I remember we went to a community center, and these kids, their questions were so intelligent. We knew they were hearing them at home. And
Yeah.
Dr. Burns was very patient in answering their questions. And so Kathy facilitated a lot of those sessions and communication avenues. So I just want to give a shout out.
And that's because you're a team player. So Dr. Burns, coming back to you, because, we're talking about how many years did you spend going to school to learn about this stuff? Look at all those diplomas.
I remember I remember 1975, and then that's the last thing I remember.
So I think that when you speak with the authority of all those printed pieces of paper on the wall behind you. And you have just done such a beautiful job handling, everything that you've been thrown, and we all throw a lot of things at you, and we know that. But one of the things that people are saying that I'm hearing all the time, and by the way, Jared and Antonio, anytime you guys want to jump in, just go ahead and do it. You know that I'm going to talk until I drop, but just pop in anytime you want to ask a question. Dr. Burns, the question that I keep hearing and popping up all over again, and this is where the misinformation is having such an impact, is why should we get vaccinated? We're going to get it anyway. Explain how vaccination stops the spread.
Okay, well, now, first off, vaccines are not 100%, okay? So it is still possible to have what we call those breakthrough type infections. But what vaccination does, actually, are a few things. The major purpose is to prevent severe illness, hospitalization, and death, okay? Which this virus has shown is just unrelentless when it comes to trying to wreak havoc. Because if you remember in the very beginning, there were so many people that once they got it, it was either near death or people that were severely ill. Now, there were some people that had very mild cases, but the vast majority, and we found that people who had what we call these comorbid conditions, as people that had the high blood pressure, the diabetes, the kidney disease, all those types of things. The people that had that, they were the ones that really suffered the most. And as Misty astutely pointed out, at the very beginning of this pandemic, it appeared as though kids were somewhat immune. Now, they did have, a lot of them, a few of them did end up having the multi-system inflammatory syndrome. But outside of that, you didn't hear much about kids being hospitalized, and definitely not kids dying from COVID. And now, because of, and I'm just gonna tell it like it is, because people have not been getting vaccinated, and it's allowed for these variants to emerge from mutations of the virus. Because I've said before, if people are vaccinated, the virus has no place to go to mutate or to replicate. If it doesn't replicate, it won't mutate. But unfortunately, because you have people who are not vaccinated, and this has allowed the perpetuation of this virus to continue to replicate and mutate. And I've said on many occasions too, I said at the very beginning, we were fine, but if this goes on long enough, these viruses will figure out how to mutate around the protections of the vaccine. And unfortunately, and I'm very sad to say that appears to be continuing to happen. So it's just one of the things where people need to, we could eliminate this pandemic in relatively short order if everyone would get vaccinated. But unfortunately, that's not happening, and that's just made everything just so frustrating. And but I'm like Delanor, and I'm sure Misty, not going to give up. Still trying to message, still trying to promote vaccination, and people who are vaccinated getting boosted to better arm and protect ourselves. Because without vaccination, we really don't stand a chance.
Somebody said the other day, if we were all getting vaccinated, we wore our masks for 4 weeks, we'd be able to almost put a stop to this virus if everybody joined together to do that.
There's probably a lot of truth to that.
Delanor.
I got a question.
Oh, yeah, right.
That came in from one of our viewers. She has a 6-year-old and a 4-year-old. She is hesitant to get the 6-year-old vaccinated simply because he's small for his size. She says that they're both about the same size, even though they're 4 and 6, and they're both about the size of 4-year-olds. So she's afraid that maybe he's not big enough, 5 and up. So what would anybody have to say about that?
Misty, you're the expert.
To my knowledge, it's your age factored into that. Certainly, you would have your pediatrician or your family practice provider weigh in, but the evidence suggests your age and not necessarily your weight. And I think that's a wonderful question from that mom to ask that, and I think that's being really kind of astute on her part. So kudos to you for thinking about that. But to my knowledge, you should be completely safe to vaccinate that child that's older. It will be completely safe. And I would just add, we have vaccinated millions of children across the country with very, 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 very few side effects. So it is a safe vaccination for children. And I would continue to add, it's really eye-opening to me. And I have been in pediatric critical care for almost 20 years, almost my entire career. And I've seen a lot of really critically ill children, but this virus is it's starting to make its way to younger children. I'm seeing 6-week-old, 8-week-old, 18-month-olds, and they're really sick. And so I just really reiterating that this is the way that we can prevent that critical illness component.
Yep, very good.
The vaccine, just to answer that, the vaccine, the CDC, the FDA, and actually the drug makers themselves, everybody has been totally transparent in this entire process. And anybody that has any questions, they can always go to the appropriate websites and look at the data, themselves, if they feel like, somebody's trying to hide something or somebody's not telling them everything about it or whatever. They have questions. And then, like everyone else has said, getting messages that is talking with what we call a trusted messenger, your physician, your nurse, your pharmacist, even people in your community that you trust, whether it be your clergy or just somebody that you know that you trust what they say. And finally, making sure, as Misty pointed out earlier, that you get your information from reputable sources. That's probably the most important thing. These social media platforms, not the place to get.
Yeah.
Unless you're a 502 live streamer.
That's
We
right.
love our 502 live streamers. I mean, really, speaking of talking to people that they trust, I mean, these live streamers have been out there on the ground for months and months and months, really telling people's story unfiltered, sharing the news unfiltered. And that's why, a platform like this is it's so precious to all of us to try to get that message out. We really appreciate our 502 live streamers.
Your check is in the mail, Kathy. Thank you. Antonio?
Well, and also, Tara, just want to say, just to throw this back to Kathy, an excellent source for every person across the state, doesn't matter what county you live in, is your local health department.
That's right.
I have seen many health departments across the state, and other health departments share that information. So they have a wealth of knowledge, and it's solid, it's good. And so, I think to your point and to your health department team, like, kudos for putting the information out there. And that's an excellent resource for people.
Yeah, thank you. I'm not sure that, people, I hope people know that on our website, we have a COVID dashboard where you can go and see for yourself daily what our COVID case numbers are, deaths, vaccination rates. You can see the demographics of cases and vaccines. You can see maps of what are the most vaccinated zip codes in Louisville and what are the least. And all of that is right there at louisvilleky.gov that you can see at any time.
Yeah, I'm putting that up for people to look at too, which is really important. louisvilleky.gov. It's a site for all kinds of information you can find out about testing and resources and vaccinations and everything else. So that's perfect.
The Team Kentucky address that Governor Beshear did yesterday had a whole lot of information about Kentucky as a whole as well. So
yeah,
I'd recommend, if anyone hasn't seen that yet, go and watch that.
Yeah, it's a lot. It's interesting that a lot of people say that they don't trust the government. And that's why we talk to medical experts like Dr. Burns, like Delanor, like Misty. And it's very sad when you say, it's at the point we're at now is people are saying they don't trust anybody. So the problem that we have is you have to trust someone at some point. And if you don't, you're going to be in trouble, because there's always somebody who's smarter than you. There's always somebody who knows more than you. And all of us have different areas of expertise. And I think that's one of the most critical things. Let's address the question, and I'd like my brother Antonio to take this one on. The resistance in the African-American community, particularly because of the history of abuse by the government, the testing, the involuntary medical procedures that have been done on Black people for centuries. And Antonio, take that away.
I want to thank everybody that's been on the panel. I apologize for being late. Excuse me. This is, I have a nonprofit and this is grant season, so I'm chasing money. But I want to thank Kathy. Hey, Kathy, how you doing? I see Delanor. How you doing? I see Mark. I see Misty. So I know all of you are. How you doing? How you all doing? And of course, Jared and Tyra, of course. Thank you all for being on this wonderful panel to give out correct information. But just thank you for being here. And we are soldiers on the front line. That's what we are, because we are at war with this virus. But not only this virus, we are at war with misinformation and with people trying to be professionals who haven't even gone to school to study medicine. So that's where we're up against. Social media is playing a very big part, probably the biggest role. Social media is playing the biggest role in the reason why our country is so divided, especially the Black community is so divided on getting tested, not just the vaccine, but even on getting tested. So of course, what you're leading to, Tyra, there has been a history with the African American community and the health community. Let's be clear on that. There has been issues between the African American community and our federal government. These systems, all these systems, just about. However, again, what's adding to that is social media. So we have to do better. What I'm learning, along with working with Metro Louisville Health and Wellness. Am I saying it right, Kathy? What I am learning is that we have to do better with our messaging. We have to do way better. So for every time that a piece of misinformation comes out, we have to battle that with 10 platforms of good facts to combat that. So we got to be better at our messaging. If there's a flyer that goes up with misinformation, we got to put a big billboard up. If you got one person saying something, we gotta combat that with 5 doctors. So we have to do
nurses and
nurses and specialists. Yeah, doctors, nurses, and specialists. So we have to do one thing we're not doing good. Again, we're not getting our messaging out and being effective, especially on social media. Because I know just on one of my posts that I had up just last week, I believe, and Kathy, I told you to go look at it, and I was talking about how these immediate care centers are having long wait times. And of course, we had the naysayers hit my post with all kind of misinformation, and the problem was that they were the majority ones commenting. So it was a lot. So we weren't win that battle, you know. So we just have to do better with the messaging. We gotta start really putting the information out there. We gotta be quick about it. We gotta be urgent about it. We have to be steadfast. We can't give up. I know we're not gonna give up, but there are people out there that are just, this is how they make their money. This is how they build their platform, with giving misinformation. If people start getting the shot, it's going to put them out of business. People are not going to buy their product. So this has a lot to deal with money as well. We have to realize that.
Antonio, do you know any good podcasts people can listen to get the facts?
Oh, yes, absolutely. You can listen to the Real Time podcast that is on the iHeartRadio app. Metro Louisville Health and Wellness is the sponsor for that podcast, and I'm not ashamed to say that, because I am a soldier on the battlefield for saving lives. That's what I care about. I care about saving lives. So check out that podcast. I have health experts, specialists, doctors. Mark has been on my show. Shout out to you, Mark. Shout out to Mark has been on my show. And I'm coming for Misty and Delanor. I'm coming for y'all, all right? Got to get y'all on the calendar. Okay, but just health experts, specialists, people who are in the field, who know what they're talking about. They know the research. They are in the hospitals with the patients. They have studied the virus. They know the research. These are the people that we need to be listening to, and these are the only people that I will be interviewing. And I'm not interested in doing a debate, because debate does not solve problems.
That's right.
It does not. And I urge anyone that is on the channel and anyone that's listening to us, do not debate with the naysayers. Do not debate with them. Our job is to get to the work. It's the work that matters. It's saving lives that matter. And so that's what I'm about. Again, you can listen to the Real Talk with T-Made podcast, iHeartRadio app. I'm so glad and blessed to do the show. Everybody knows, and I always tell my story. I'm sorry, Ty, but I have to tell my story about why I'm so vigilant about doing this work. My mom was an RN nurse.
That's right.
I was raised in a medical household. I understand how these things work. My mom always had it around me, and I just know my mother, who's in heaven now, she would be proud to see the work that I'm doing.
Yep.
To save our people. It's important. So we all have a role to play. We all have to do our part. But I think the important thing that we really need to talk about is, which Kathy urged me the other day, we have to also talk about people who are walking around not getting tested. That is another thing that we are battling. We are battling people walking around who are sick, who know they have symptoms, who will not get tested. So we also have to talk about that. And so, and also I think this is another thing, you all, is there some type of, and the doctors may have some comments on this that I would like to know. We know that America is in a very unique situation to where we are a capitalist country. We know that. And our country is divided on getting the vaccine and not getting the vaccine. We are divided. That is a fact. I'd like to see some research on some countries that are not divided on getting the vaccine, where the majority are doing the right thing. Because we know that the media, the mainstream media, is never going to show us that side, because the narrative has to be that America is the greatest country in the world, that we are unified, we're together, we're strong, we're powerful, nobody can defeat us, and we're the best at everything. But I would like to see some research on some other countries that are doing the right thing and what those numbers look like. And those in the media world, we can get that information out and just prove that, like Dr. Burns was saying, if you get the vaccination, if you get the shot, it cannot mutate. The numbers will go down. Like he said, if it can't replicate, it can't mutate. So I would like to see some numbers from some other countries to help us, to as an example of countries that's doing the right thing and what's going on over there. Because we know our mainstream media is not going to do it. But with our independent media, like the 502 live streamers, if we can get the data to get that information out, that will also be helpful as well. We got to look at some great examples.
And we've got a ton of questions that are coming in that I want to run through real quickly. One of the most, yes.
Before, I'd like to, could any of the medical professionals also add to Antonio's information, just in hesities in the African American community? Like, how would the medical professionals address that hesitance?
I'd like to start off, and Mark will always finish up because he's so good at that.
A little louder, Delanor. A little louder.
I said I'd like to start out because one of the things that when you were asking about the historical perspective in the African American community, we have a historical perspective, but we also have what's going on today. And one of the things that Mark, you do the history, I'll do this today. One of the things that I'd like to bring forward is for the medical community, we have not always treated African Americans and brown people, non-white people with respect. And so therefore, we have not gained their trust. And I'm talking about today. I'm not talking about the past. I'm talking about today. But I think what the pandemic has done for us is to give us an opportunity to address those issues and to start developing the trust. And by going to the community and answering the questions and being the people that people who have the questions can actually say, I could ask Dr. Burns, he'll tell me the truth. Or I can ask Delanor, she'll tell me the truth. I get a lot of calls, at the office that say, Delanor, I saw you on such and such. What about this? Or I might get an email. But the point is that we are developing that trust for the community right now because we have not done a good job in developing that trust prior to the pandemic. So you can't expect people who you can't trust to tell you the truth. So I want to know that you care about me before I ask you a question that I'm going to trust the answer. And I think we've been doing a very good job with that since the pandemic. And Mark, you get the history.
Go for it, Dr.
Okay,
Burns.
well, I'll keep it brief because I know, Tara, you have a bunch of questions. And as everybody has alluded to, within the Black community especially, when it comes to medicine and the government, relations have not been really good. And there have been so many egregious acts in the past, but probably the absolute worst, in my opinion, and they're all bad. Don't get me wrong, but the one that always stands out to me is the syphilis experiment in the early 1930s, I believe 1932, also known as the Tuskegee experiment, in which time they misled a lot of the Black sharecroppers, stating that they had bad blood and offering them treatment. But in essence, they were giving them saline water, and these men had syphilis. And this was really a longitudinal study in the natural history of syphilis. Even when penicillin was available to treat these men, they weren't treated. It was on purpose, again, just to see how this disease evolved. This went all the way until 1972. I believe Dale was in high school. But 1972, and when a reporter from the New York Post was about to break the story, at that point, the government stopped. And when you think about things like that just lends itself to mistrust within the government. So unfortunately, that's just a very small example. But there have been other examples too of the government and mistrust amongst minority communities, particularly in the Black community, in this particular aspect.
Thank you very much, Dr. Burns. A couple of questions that have popped up on my stream. Somebody said, once a patient is positive for COVID, are there any primary care physicians that will treat COVID patients, or is the hospital the only care available for a patient with active COVID?
Let's see. If they do not have a provider, they actually should be working to get a provider. Now, it depends on how ill they are. If they're severely ill, then they need emergent treatment, then that needs to happen. That is, they need to go either to the immediate care center, or if they're severely ill, they need to go to an emergency room for treatment. Because unfortunately, this disease, this virus, is very unrelenting, and it's usually seen in people that have other medical problems, what we call comorbidities. People that may be obese, high blood pressure, kidney disease, amongst other heart disease, amongst other things. So if you're at high risk and you've been tested positive for COVID, you really should see someone, because at that point there are some therapies that they may be able to give to avoid, or to help a person avoid becoming severely ill if that COVID persists. But yes, everybody should have a primary care provider. Absolutely true.
Yes.
I think the
you
key for that is symptoms.
Right.
That if you are asymptomatic, you do not need to go to a primary care physician. You can stay at home and isolate, and stay away from people. Wear a mask even when you're around your family members. But I think Dr. Burns is talking about people who have symptoms that they need to have treatment, and that they should not be doing trying to put themselves on a ventilator at home. Okay.
Yeah, makes sense. Right.
Dr. Burns mentioned the ER. Just for clarification, if people have minor symptoms, should they go to the ER to get a test, or should they seek a test before?
If they have no symptoms, then there's really nothing to do. If they have symptoms, then they're not sure what it is, they need to get tested to find out, is it COVID? Is it the flu? Is it just a minor upper respiratory problem? They need to get tested to find out, so that they can't spread it to other people.
Right.
If they're severely ill, then they need to go to the emergency room.
Right. So
minor
only
points to
go
that.
if you are severely ill. Right. Like,
Correct.
You should try to get tested before flooding the ER, because we do have a lack of beds at the moment. Right.
Mm-hmm. Yeah, and I think that's the point, is that if you're severely ill, or even depending on if you're moderately to severely ill, then you should seek treatment. But if you don't have symptoms, or if you just have like minor symptoms, you can just treat yourself at home. But I also think that this is also happening, is that any symptom that you have, runny nose, cough, it is COVID until proven otherwise.
Right.
This concept that people keep thinking that they have the common cold, or they have allergies. So we have to take that off the table. When medical people, we stack up differential diagnoses. Okay, we go 1, 2, 3, 4. We hopefully don't have that many, but somewhere in those top. Right now, if you have those symptoms, sore throat, cough, runny nose, fever, it's COVID until proven otherwise. And so wash your hands, wear your mask, and get tested.
Amazing.
I think, Tara, sorry, Antonio. I was just going to say, I think Dr. Burns and Misty would also agree. And I think Jared was maybe getting to this point. If you need testing, you should not really go to the urgent treatment center, and definitely don't go to the ER. And in Louisville, I know, Tara, you guys covered the opening of the mass testing site that's now at Churchill Downs in the Orange Lot, and they can test up to 5,000 people a day. And there are many testing sites all over the city, and we have them listed as well in our COVID resource center on the website. But our ER doctors and nurses and urgent treatment centers are trying really hard to take care of sicker COVID patients, and don't want you to come there just to get tested.
Well, I went there today and I was in and out in less than 2 minutes. I literally drove up, drove right in. It was the middle of the day. So if you go in the morning or you go at night, expect to have a wait. But the other day it was only like 30 minutes. So it works out really well. And you can also go to family health centers all around the city and get tested. And you can also go to Southeast Christian. Those are all the big testing sites. And Sullivan University, I believe, has one as well. So those are all good. One more question that popped in. I know Jared's got questions coming in on his stream too, because I'm looking at them. A nurse just said, this is a great discussion. Thanks for spreading the information. I've seen unvaccinated COVID patients. It's not pretty. Thank you. I will share this discussion. So sharing this live is a big way to contribute to the cause. And people who are watching and liking what they're hearing and understanding what they're hearing, please do share the live. And another question that just came up, are there better options for better home testing? Because we've seen this enormous shortage. And even though you guys supplied all the community centers with a lot of tests a while ago, those have been drained. And unfortunately, from what I understood Dr. Sarah Beth to say yesterday, Dr. Sarah Beth Hartledge, there are a lot of false negatives in the home tests. You're going to get a positive if you're positive, but you're not necessarily going to get the best negative result. Can you talk about that for just a minute? Either Kathy or Delanor?
And to add on that, what would you all recommend? Because that's what I was going to ask.
Right.
At-home test or just to go to a testing site? What would you all recommend? Because I do know a lot of people who are testing negative at home, but go to a site and they test positive.
That's right.
I want to start.
Go ahead.
I want to start with some preventive things. First of all, wearing a quality mask, washing hands and social distancing, and staying away from large events. You don't have to go to a restaurant, people. You do not have to go to that ball game. You really don't. And we're talking about Omicron, which is very infectious, and it's here. It's in Louisville. I mean, I think the number that I heard earlier today was we have a 32% infection rate here. We do not need to continue doing the things that we've been doing over the holidays. We need to protect ourselves. So I want to start with protection. Okay, that's number one. Number two, let's look at symptoms. When we're talking about the home tests that the health department gave out, they are very accurate.
That's good.
From what I've seen. And the Binex test is very, very accurate. We've been using those at testing sites, but we do provide competency validation for the team that are providing the test. So if you have symptoms and you test negative at home, then go to a site and get tested.
Very important. Dr. Burns?
Can I just share a quick statistic that our doctor shared today on the briefing that alludes to what Delanor said? It's different kind of things we can do. But Dr. Moyer and Dr. Hartledge recently were looking at several modeling studies.
Something to sort of reassure you. I want to make sure I'm okay, or make sure I can go out and make sure that I can have my kids or whatever, what I call a reassurance type of test. Then the antigen test is a good test. But like Delanor said, if let's say, for example, you're ill and you're testing yourself, really a PCR test would be the way to go. But if you use an antigen test and it's negative, you should still isolate, still pretend like you have COVID, and then retest in a few days, because you may be within what we call the window period. That is, not enough virus maybe being shed enough for that test to pick it up. So that's the only point I have.
Are antibody tests...
Mark, I call it the honeymoon period.
Sorry, Delanor. Are antibody tests accurate, and can they tell you what variant you may have had?
No, antibody tests are after the fact kind of things. So really, when you talk about testing, you do have three types. You have PCR, antigen, and you do have antibody tests. But again, as far as going with regards to acute illness, the PCR and the antigen tests are the best tests. Antibody test just tells you you've had COVID, and in truth, it doesn't really tell you which coronavirus that you've had, because there are some human coronaviruses that are still that are still among the community. Those were the so-called real bad chest colds people used to have. But it doesn't. These antibody tests don't differentiate which coronavirus we're talking about.
Good point. Go ahead, Delanor.
Too quick. Is there any idea of infant vaccine coming anytime soon, and how often do you recommend people get tested?
I'm going to start with, you get tested if you put yourself in an unsafe situation, like that ball game, that dinner you went to, that wedding, that funeral. You need to test. Because I can assure you there are people there who are probably infected. I think the statistics from this morning is 1 in 15 in Louisville are infected. So if you've got 15 people in a room, one of them is infected. And at that funeral, there were 115 people. Okay. And Omicron stays in the air for 3 hours. Get tested.
That's key right there. Somebody just asked, are there tests available that test saliva instead of nasal mucus? It's very difficult to test disabled kids nasally.
There is a lab locally, and actually they are statewide, that does a saliva test. I've read about the accuracy of that saliva test. The data that they put out says that it's very accurate.
Good to know. Anybody else needed to weigh in? Did I interrupt anybody else? I'm really good at that. So it's 9 o'clock. It's actually 5 after 9. We've gone through a whole lot of questions. Is there anything you guys would like to say to kind of wrap up and share some more information that's absolutely incredible and valuable?
There's a comment on Facebook that says, I think the issue is that in the start, so many nurses came out saying it was a lie. And I think the lie that they're talking about is COVID.
Yep.
I can honestly say that we have learned so much in the last 2 years. As the science has given us more to work with, the medical community has been using it to make good choices and provide good treatment and to give good advice to the community. And so I can honestly say that the more we learn, the more we share, because as Dr. Burns says, the medical community is being very transparent. We feel it's our responsibility to give the community the information so they can make good choices. And in many cases, people have not made good choices because they haven't had the right information. Absolutely. Or the correct information.
Absolutely. Dr. Burns, any final thoughts?
No, just what I always conclude with, everybody, I think everyone should be vaccinated. And if you're vaccinated and you're eligible for a booster, you should have your booster. Just try to protect yourself, make smart choices. The public health mitigating measures still work. The masking, social distancing, washing hands, and being in good ventilated areas. All the basics that got us to the point where the vaccines came about. Those things still work. I consider those the foundations, if you will. Those things still work, but everybody needs to get vaccinated and boosted.
Thank you. Misty?
I would just like to thank all the healthcare workers out there, nurses, physicians, respiratory therapists, physical therapists, everyone that's at the bedside working tirelessly. Thank you for all that you do for our patients and our community. Kentucky, we do really appreciate all your work, so thank you. Get vaccinated, absolutely 100%. Wash your hands, find yourself in safe spots, and wear your mask.
Very good. I wanted to hold you guys over for 2 minutes after we sign off here, because we've had a couple of questions come in that I need to get answered that we're not going to have time to answer now. But let's do this again in a few weeks. and hit a lot of the questions that we didn't get answered, because there are so many more I can't even tell you. And I cannot bear to keep you guys after 9 o'clock at night when you've been up since probably 5 o'clock this morning. So I really want to thank you. I do. I really want to thank you all. You're just amazing, amazing people. Delanor Manson, Dr. Mark Burns, Misty Ellis, thank you all so much. Antonio, thank you for your share of information. That was really, really helpful too. Kathy Turner, always a pleasure, from the Department of Health. Jared Wright, Riot and all the 502 live streamers are going to be sharing this, and I hope a lot of you will too. And we really appreciate you guys. Thank you so much for your hard work. You're our healthcare heroes in so many ways. And I hope that the information that you passed along tonight will be extraordinarily informative and helpful to those who are watching, and that these live streams will be spread. Thank you.
Thank you.
Stay healthy, everyone. Get tested, get tested, get tested, get tested.